Well, welcome everyone. We're going to try to do this at least once a year, maybe twice a year, an opportunity for you folks to hear a little bit of what's going on across the Health Science Center in each of the 4 schools, centers and institutes, and really what's more important, I think, is if there are questions that you folks have, you have a venue in which we can address them. So emails are only so good for communication, and often they're lengthy and you have to read them and try to figure out what's really being said. So I thought doing this on an ongoing basis would be a good idea. If you folks have ideas about how to make this a better session, please email me directly. It's dldunn01@louisville.edu. I'd love to hear from you. Just by way of overview, I've been here a little over 3 years. I love it here. My wife and kids live up in Prospect, 10-and-a-half-year-old boy-girl twins who go to school at Goshen Elementary. It's absolutely great school system up in Oldham. And we really love the environs here. But I think as important, I've come to really love and respect what we're doing here at the U of L. Harvard, Stanford, Big Ten institutions such as Michigan and Minnesota, where I did my training and spent time as a faculty member, have enormous resources, well beyond what we can often imagine here. And I mention that because I won't say it's easy to be a faculty member or an administrator at some of those very prestigious schools. But with those sorts of resources, it's often easier to do things. And as Jim Ramsey, our resident economist, has told all of you on numerous occasions, and I've come to know the lore, the U of L has suffered budget cut after budget cut after budget cut, 13 in a row. And that makes things very, very difficult, but it also presents some very interesting surmountable challenges. I'm going to tell you about 2 of them that I've had the privilege to deal with. And I think it drives us here at the U of L in a very different way. It makes it, because it's harder to do things, because in the healthcare field, we have a very, very sick population in the Commonwealth. I view it as an opportunity, actually, because we're driven to do things differently, to do things where we have to think out of the box at times, perhaps most of the time rather than some of the time. And we can also move the proverbial needle in ways that Harvard, University of Michigan can't, because they're not dealing with the plethora of problems, particularly in healthcare, education, poverty, social issues that we are here in the Commonwealth. So that, quite frankly, is one of the main reasons I was attracted to the University of Louisville. But in terms of telling you about some of the things that I've been involved in, I think the most interesting one was the deal that we did with Kentucky One Health. And there are many in the room who helped negotiate that transaction with me. Jim Taylor, for example, on the UMC side, Jerry Johnson, Tony Gansel, and others. And the reason that was so mission critical to us is that UMC, our university hospital, where University of Louisville physicians and many of the other health disciplines practice, was projected from a financial perspective to literally have to close its doors within about a 4 to 5 year period unless we could find a health system partner. When the governor halted our involvement in a full asset merger, that was a tough day, December 28th, 2011. But we bounced back and came up with a new way of dealing with this, with a competitive request for proposals, and developed a very close working relationship with both the governor and the attorney general. And you know the rest of the story. It's a $1.4 billion deal in terms of what the financiers call discounted cash value over the next 20 years. But that's a big number, but in fact what it does is it provides really 2 things. Financial stability for a health science center and for UMC itself, and a statewide network that we hope will have a wealth of referrals and the ability for us to get out across the entire Commonwealth rather than just be in a bastion here within downtown Metro Louisville. The support that is being provided has been a long time coming, to use that phrase from one of my favorite songs, but it's now here, and we have over $40 million where we can recruit faculty across all of health sciences, and that process has already begun, led principally by Dean Tony Gansel and Dr. Greg Postal. The second thing I'd like to talk about is Suzanne Ilstad's work, and I'm going to just pick one person to talk about, one of our superstars for every one of these sessions. I could mention Roberta Boley, I could mention Susie Harkema, I could mention many of the people in the room, so please don't be put off by me not naming one of you. But Suzanne, the Regenerex Novartis transaction is a very interesting transaction that I want to just briefly describe to you if you don't know about it. But the importance of it is not the transaction per se, because I'm beginning to sound like a Wall Street banker up here talking to you about transactions and the finances. And in fact, what really drove this process is the science behind it. And so in 1938, Sir Peter Medawar, an immunologist, who subsequently, the Sir part, was knighted because his work was so impressive. He described something that was a possibility in the field of transplantation. And that was something called immune tolerance. And it was just a theory back then. But it literally has been the holy grail of transplantation immunology and clinical transplantation for the rest of the century and going into the 21st century as well. And in essence, what it means is coming up with a way to trick the body, so the body that receives a transplant, into thinking the transplant is part of the body and not, it is self and not non-self or foreign tissue. Suzanne's done that with some very interesting technology. But you have heard, I presume, about warfarin for the University of Wisconsin. That brings in millions of dollars every year. Gatorade for the University of Florida. Again, millions of dollars. I personally think that when the largest pharmaceutical firm, a multinational pharmaceutical firm in the world, gets interested in something like this and begins the process to bring it to clinical trials and clinical fruition and bring it to the market, and they predict a $4 to $8 billion a year market for this, and the U of L owns a piece of that. I think that's pretty interesting, and I think that it's pretty interesting that Suzanne and her team have come up with this, because we've got members in the audience here, and I want to recognize their work. But the essence of it is there's an interesting personal aspect to this. I've known Suzanne Ilstad for over 30 years because she trained at the Mass General as a transplant surgeon. I trained at the University of Minnesota as a transplant surgeon. And when I first arrived here, her name appeared on my schedule, and I had no idea that she was here. So that sort of work that's being done at the U of L puts us on a par with the other institutions that I mentioned. And we should be very proud of that, because there are a lot of people doing this type of work, not this specific type of work, but this caliber of work here. So I guess the last thing I'd mention is I think the Health Science Center here is a real jewel. And increasingly, we're seeing that we're not siloed in the different units. These folks up here are going to talk about it, the 4 Health Science Center deans. They're going to talk about their individual work, but I hope they'll also talk about some of their collective work and collaborative work that they're doing together. I would like each of them to briefly touch on sort of highlight some of the things that they think are important that are going on in their respective schools, but also talk about a accreditation issues, current and upcoming, that people may have questions about, and any challenges that they want to discuss. So I'm going to stop there. Thank you very much for being here. And I'd like to introduce Dr. Tony Gansel, the Dean of the School of Medicine, to address you. Thank you.
Well, thanks to all of you for coming, and I'm glad that we're going to have more of these sessions, and I hope the next session that you guys won't all be at the back of the room. We're going to ask you to come forward a little closer. As Dr. Dunn said, there are a lot of things going on at the Health Science Center, and it really has been a privilege and a joy to work with these three other deans, as well as with Dr. Dunn, because if we look at our mission at the School of Medicine, which is to improve the health of our patients and our communities, that really is the mission of all four of the health science schools, and we really believe that we can work together as schools to help leverage that and truly achieve that goal. We have a very unhealthy community, if you look at the statistics, and a pretty unhealthy commonwealth, and I think that we can move that needle by working together. So there are four things that are really going on and that are at the forefront now with the School of Medicine. The first being our LCME efforts. We had an exciting day yesterday as we had the ribbon cutting for our new renovated instructional building, and it turned out beautifully. So those of you who haven't been over and seen the building, I really encourage you to do that, and let me know. We'll have a student or two take you on a specific tour of the different spaces, but it really, really turned out wonderful, and that was a big issue for the LCME. You know, we tried to make the building is 40 years old. It has had some window treatments, if you will, but if we look at the building now and with the renovations that have taken place, it probably wasn't adequate. I mean, we tried to make the case that it was adequate, not optimal, but adequate, because we were planning on, the new building. But this new space is absolutely tremendous and truly supports a contemporary curriculum in ways that our other building couldn't. It's got state-of-the-art technology, lecture halls that are much, much larger. It seats 180. But more than just the size, it's the design of the lecture halls, because not only are they fit for lectures, but they really are able to accommodate a lot of interaction. So there's a tiered lecture hall, but the seats turn and they can interact as small groups. And then there's a flat floor lecture hall with tables and monitors in groups of 6. So it really turned out great. And the former unit lab infrastructure was able to, in a way, be preserved with the new advisory colleges, so that each student kind of has a home space, if you will, and those can also be used for small group classrooms. There's also new individual study spaces, new lounges for the advisory colleges, a kitchen. So it really is just a tremendous space that also includes individual study spaces as well. I'm sure that all of you have seen the renovations of the library too. The library, the stacks went away, and those books are being stored off-site at a climate control and temperature, humidity controlled area. But it really opened up the space, and the library is open 24/7 now, and students are really utilizing it, and that's going to help as well. That was one of the areas. Then the other two main areas with LCME related to curricular design of the first year, that it was still discipline-based. We had integrated our second year in many ways, but and we'll increase that even more. But the first year was still discipline-based. There was the plan over the past 18 months that had been created to make that interdisciplinary and more integrated, and that rolled out along with the new space. So it was really that was really great to see. Then there are a couple of areas really that related to curricular oversight. And now that we have these systems in place, we're going to be able to do a much better job at really having systems in place and technology tools that will allow us to better track and monitor centrally our curriculum. We know that faculty development is going to be a big part of where we're going in the future with this, but those were the areas, and we believe our action plan has come a long way to help that. We submitted the action plan August 1st. The LCME committee will take a look at that action plan early October, and then if they endorse the plan for being serious, for being achievable, and for then being adequate to put us on the road to complete compliance with all of the standards, then we'll in early November hear about our focus site visit, which we think will be in the spring or early summer. If it is in the spring, then we know that the findings will get to the LCME meeting next October 2015. And if it's a little later in the summer, which we hope it won't be, we hope it's a little earlier, because if it's a little later in the summer, it may not get to their report may not get to the committee until their February meeting, but we're hoping for October. So that's probably the single biggest thing that we've been consumed with. We've got we have our strategic planning process that is rolling into the next phase. The first phase of it was just design and looking at the different teams with our clinical enterprise, our research enterprise, our educational enterprise, and our community engagement. And they developed a set of priorities for each of those. But now we are looking across those priorities to really refine our vision and to identify metrics to help us measure that and make sure that we remain on track. So lots more on that to come. The third thing is that Dr. Postel and I are working very closely to track and to roll out the new Kentucky One investment. So we will be recruiting about 80 faculty members over the next several months. So that's going to make a big difference in growth of our academic programs, and we're really looking forward to that. And then the last thing really is we're continuing to move forward with ULP. There have been so many strides made in ULP, and Greg Postel has done a phenomenal job as the new CEO of ULP, and all of the other chairs and faculty leaders have really just done a tremendous job, and we're starting to see more of a culture change towards a unified vision and approach, because what we want to do with ULP is to create and position ourselves such that ULP is the multi-specialty physician group of choice for the entire region. And we've got a lot of things that we're doing in that regard. So those are the 4 things that we're focusing on, and I would be happy to take any questions.
We're going to do questions after everyone speaks.
Like I said, at the end of when everyone speaks, we'll take questions. Thank you. It's my pleasure to introduce my colleague, John Salk, who is I started to say president, who is the Dean of the College of Dentistry.
Thank you, Tony. You know, in like fashion, we have somewhat similar challenges. We're facing an accreditation visit coming up here in March, 17th through the 19th. And as you well know, these visits always create a fair amount of angst, no matter how well you're prepared. You're always looking at where you are and where you're going, and hopefully you've done the correct things over time. We brought in a mock team to give us a little bit of guidance, to take a look about where we were and some guidance about where we should be going in the future. And, you know, I think for the most part, we're in reasonable good shape. However, much like I think what Tony talked about with regards to how we monitor our curriculum, and how we instruct in that curriculum is going to take a little bit of refinement. In professional education, I think we're actually ahead in education with regard sometimes to what happens on the undergraduate campus and the like, in that we don't necessarily give competency in a single course. We have to give a global assessment over the course of 4 years, whether this individual is competent to be a dentist or a physician. And that basically requires demonstrating that we have building blocks at various course levels, and how do we assess those things, and what kind of summaries do we basically come up with to make those types of global assessments. Mapping that out becomes a little more intricate than I think we originally thought it was going to be, but I think we're making reasonably good progress in that direction. And I'm certainly optimistic that we should do fairly well. Just a few other things I'd like to touch on. Overall, the vision of the School of Dentistry is to sustain and further develop the unit as a nationally recognized top-tier school. Now, that's not as moronic as it sounds. If you go back and look in 2008, we ranked 12th out of 68 schools. So we were almost near or at the top tier at that particular time. We slipped a little bit over time, and part of it has to do with budget cuts and difficulty it is to recruit new people to fill in some of those gaps. But we're still in relatively good shape. We rank right now 18th out of 68, which is at least still respectable. And I think we're still making progress along that area. One of the things that we're also doing is we're taking some strategic opportunities to sort of broaden the picture of what we're doing and become more integrated into healthcare in general. So we're exploring, certainly with Kentucky One and other health science partnerships, the establishment and enrichment of prevention and wellness programs. And currently, as many of you know who are in the School of Dentistry, we have relationships already with the Home of the Innocents, Healthcare Cares, Matthew 25 Aid Services, the 550 Clinic, the Ryan White Care Clinics, and Volunteers of America. And currently, we're basically exploring, actually they're exploring with us, because of their interest in broadening oral health care, situations or possibly relationships in education, graduate education, in care with the St. Elizabeth Hospital System up in the north. And just most recently, we've been contacted by Lourdes and Western Baptist hospitals in the west. So, these are certainly works in progress, to be sure. One of the other things we've been fairly working intently on and sort of broke a little ice in the area has to do with interprofessional education. And IPE, for the most part, has sort of been, a mantra out there for a little while across the country. We took a little different approach towards IPE. Most IPE programs start off by taking first-year students, be they medical, nursing, dental students, whatever group you can bring together interprofessionally, and begin to orient them didactically going forward. We took a sort of a big leap, and we did just the opposite. What we ended up doing is we started actually not so much with an IPE program, but with an IPC program, bringing in the nurse practitioner program directly in the clinic on the front end and orientating those individuals, nurse practitioners within that master's programs, and our students with the nurse practitioners, and have now worked backwards into a didactic program which enriches them in various phases of IPE. I personally think it was probably the smartest thing that we could have done, although at the time you had to really wonder whether you had the cart going in the wrong direction. And we're certainly looking to expand that program more in the future. We're certainly looking to promote interdisciplinary collaborations and integrations between various parts of U of L. We want to build up our research and scholarship programs, certainly working more with clinical and basic sciences across this campus and the other campus. And in particular, we'll be looking to focus some of our efforts both in the Cancer Center, in restorative medicine, and in advanced manufacturing. We currently have a couple programs already going on in advanced manufacturing, which I think are really kind of exciting, and I think there's been enough disclosure that I can talk about them. One of them has to deal with using additive manufacturing in fabricating implant-like devices. Now, that's not only for the jaws, but also for long bones as well and other types of areas. Mainly because, to make it real simple, you need a certain, if you don't have a little bit of a modulus of elasticity, you induce bone resorption. And there's ways basically of actually modifying titanium in structure with other agents to create a little bit of a modulus. The other program, which I think is kind of novel also, since I worked in the field for a long time and didn't have a clue about the physics of what was going on, was dental enamel, by and large, you think of as a very hard, brittle substance, but there's a lot of protein that's present, not a lot, but there's protein that's in there. In like fashion, that creates a modulus. Consequent to that, it can be fractured relatively easily, but not as easily as ceramics can. And what this group within the School of Dentistry and at the Speed School have done, they're using additive manufacturing to include other agents along with apatite to create a modulus and yet get perfect translucency in ceramic-like products, both for dental restorations and certainly in a variety of other fields. So I think both of those are fairly exciting areas that I think we're going into. And then finally, certainly one of the things that I've had an interest in was international collaborations and partnerships. We had a couple of visiting students on our first exchange with Jagiellonian University out of Krakow, Poland. That place is a sort of an interesting university that dates back to 1304 with a long history and really just flying forward at this time. They have a close affiliation with the Max Planck in Munich. And it's a robust operation. And we'll be sending some students up here in November. We're also looking to also spread those collaborations into other international sites. But I want to basically focus to some degree on academically strong sites, like the Weizmann, for instance, and a few other areas, let's say the Max Plancks in Europe. And I think I can stop right there, and we'll take questions a little bit later on. And then my partner here from day one when I arrived, Dr. Marcia Hearn.
Good afternoon, and thank you all for coming this afternoon. We're glad to see so many faces. It's really fun for me to talk about the School of Nursing. This is our 40th anniversary year, and we're doing a lot this year, and we have been doing a lot. We're a highly responsive faculty of about 49 and have one of our highest enrollments now of 1,300 students. Our bachelor prepared entry into practice nurses are highly sought after. Almost every hospital in the city, around the state, and around the nation clamor now for baccalaureate-prepared four-year degree nurses. The literature, according to Linda Aiken from Penn, clearly has documented the improved outcomes with decreased mortalities and decreased comorbidities as a result of having more BSN-prepared nurses. So we know we're going to be busy preparing even more, and as a result, we've increased our enrollment to grow those particular members of the workforce. In addition, we're being responsible, I think, to the Affordable Care Act. We have 6 nurse practitioner majors, 2 acute care, being the neonatal nurse practitioner, and also the adult acute care, NP. We also have the other 4 as primary care. Those are adult, family, women's health, and psych mental health. In conversations with the Department of Pediatrics and the School of Medicine, we are now embarking on starting the pediatric acute care MP. So we will have every population across the lifespan represented in the academic endeavors of our graduate program. We have had the PhD program since 2005. But now what we're going to be doing is beginning a clinical practice doctorate. the Doctorate of Nursing Practice. We've been mandated by American Association of Colleges of Nursing to start that in 2015. We really decided consciously to focus on our research initiatives with our PhD. We have done some extremely strong outcomes I'll talk about in that regard, but now we're pretty well staffed with several DNP prepared faculty, and we are now armed to start that second terminal degree as a DNP in our School of Nursing. So we're really adding to how we're shaping the workforce of the state and the city, and I would even say beyond in the nation. We have had a strong partnership now with Kentucky One, particularly with their new CNO, Belinda Block. She is our Executive Associate Dean of Practice for our school. She comes to our retreats. She consults with us on the DNP, for which degree she also has. We're very thrilled to be receiving some funding from Kentucky One, and that we will be helping to meet their needs in terms of workforce development by preparing more BSN and nurse practitioners. They have a strong mandate within their strategic plan to have more than 200 plus NPs in their system, and we're going to help do that with a hybrid online delivery. As far as the research, we've been extremely productive, and that's a lot of thanks goes to our Associate Dean of Research, Dr. Lynn Hall. We have really consciously said we want to incentivize our faculty to bring in extramural funding. So we created an incentive model for any faculty member bringing in extramural funding and giving them some extra dollars at the end of the fiscal year. We also have incentivized our master's prepared term faculty to go on and pursue either a PhD or a DNP. Why? There is a dramatic faculty nursing shortage, and the average age of a nursing faculty is in her or his early 60s. So we're going to see a mass exodus in a few years. Therefore, we are going to grow our own, and we're proud that many are in our PhD program and also in other DNP and PhD programs. Most importantly, we see great value in incentivizing our baccalaureate students, because we do have a track to the PhD of the BSN to PhD. And so we now have 15 undergraduate student research scholars working with 6 of our faculty. One of our biggest brags right now is we have a very talented endowed chair. We only have one endowed chair position. But Dr. Barb Polipka, who came to us from Ohio State about 3 years ago, has won RO1 through NIOSH, where she is studying home health care professionals hazard training using virtual simulation. And now we're proud to say we anticipate next month that she will have her second RO1 as a PI with Dr. Rodney Boltz, where we're really doing more interprofessional collaboration, and that is through the National Institute on Aging. It is with asthma in older adults, identifying phenotypes and factors impacting outcomes. Our research extramural funding has increased over 300% since fiscal year 13 to fiscal year 14, and we're highly proud of that particular accomplishment. I could brag about so many of our talented faculty who received so many national awards. I commend Dr. Whitney Nash for being the PI on the interprofessional HRSA grant that John Salk was talking about with our dental school residents and our master's nurse practitioners. That was her vision to implement with Dr. Salk and myself, and we're really proud of that, and the outcomes are very strong there. We also reach beyond the boundaries of Kentucky. We are out with study abroad across the globe. We have 36 students with 4 different nursing faculty transcending the borders in Belize, Croatia, Botswana, Scotland, and one of our doctoral students just graduated, finishing collecting her dissertation in South Africa. We know we are a global school on the move. In terms of community engagement, we have tallied the number of hours our faculty, our students give to this community. Do you know that we have provided more than 47,000 hours in student faculty hours? That if you tally that in terms of service dollar values, it equates to nearly $850,000. It is a very important point to put into many of our grant applications. And lastly, I want to say that we're closing out this wonderful 40th anniversary with a very, very special celebration. It is our first Florence Nightingale Award ceremony that we will be hosting on November 6th at the Melwood Arts Center. And we received from the public, from Kentucky, from Southern Indiana, more than 100 nominations. And we have selected some of the most compelling individual registered nurses around the state to receive that award. Look at our website. Feel free to come and bring your friends. That's what the School of Nursing is doing in their 40th year.
So I'm the newbie on the block, Craig Blakely, Dean of Public Health. I've been here about 15 months, and I wanted to make that point simply to say there were 3 reasons why I personally decided this would be a good place to come. One is I really respected the university mandate to become a Research One institution, the legislative mandate that supports that. I was very impressed with the Vision 2020 document, not so much in the details, but the fact that it really pushed toward community engagement. And it was so obvious to me that that's a true part of what the university is trying to do, not just part of a vision statement, but as you can look in every single college and find somebody that's responsible for making sure that that moves forward. And the third thing, HSC leadership, that from my perspective was willing to look outside the box, and I was interested in those kinds of opportunities. And so I came here with several goals in mind, and so let me just articulate 4 things that we're working on in the school. 1, we want to establish a global presence. 2, we want to build an undergraduate program. 3, we wanted to establish a strong health policy focus. And finally, we wanted to be visibly engaged in West Louisville. And so I'll just comment briefly on each of those. So I'll start with global. If you look at the top 25 schools in public health, they're all doing something in global public health. And I'm not talking about international where you simply have a presence somewhere. I'm talking about looking at big picture global health. But if you look really carefully, what you'll discover is the vast majority of them are creating wonderful opportunities for their students to go out and get a summer experience somewhere where they learn a lot about what the rest of the world looks like, but they have next to no impact on anything that's going on there. Or they create an environment where students from some foreign institution can come visit their institution and again get a very different eye-opening experience. If you look more carefully, there's a handful of the top 10 schools, and I'll just try and knock off a few of them. So Harvard and Hopkins and Minnesota and Michigan and North Carolina and Tulane. Those are institutions that are actually treating global health as a major initiative and are seeking to create change in the global health setting. What I want to do to bring our public health school up a notch is to go play in the sandbox with those top 10 schools. We won't become a top 10 school because of that, but we can be visibly engaged in ways that will allow us to get recognized as someone that's playing in that sort of a sandbox. And so, again, thinking outside the box, what we're going to do, and I'm optimistic that we may actually sign a contract to get this started next week. We're going to set up essentially a satellite public health training program in Lahore, Pakistan. Some of you have heard us talk about that before, but that's a bit outside the box. And we're going to do it in a way that is going to leave enduring change. We're not going to transport our human capital over there to teach students. What we're going to do is we're going to identify human capital that's already over there and identify those who can become colleagues and faculty so that when we end up 6 or 8 years down the road having invested in this, there'll be infrastructure there to where this school can become accredited as a standalone institution or become a permanent part of the local landscape. And while we're doing that, the students that will be graduating will be, public health students don't get a job in one place. If you go look at formal public health departments, about 2% of our graduates end up there. Our students end up all over the place in nonprofits, et cetera. So if we spend 6 or 8 or 10 years putting students out in Pakistan, they're going to infiltrate systems. So Pakistan's got great human capital already, but they have no public health infrastructure. By doing this, we're going to have a set of disciples out there that can then help us influence policy change as well and really institutionalize the public health approach of trying to create conditions under which people can be healthy. So that's one big initiative that we're working on. Now, I must recognize that there's a whole bunch of other faculty in the school that are already doing things in international settings, and you've probably heard we've got a colleague, Muriel Harris, who's over in the middle of the Ebola process, set of activities right now, and is having a difficult time coming back, so she's engaged herself in public health endeavors over there. So that's fairly exciting as well. So the second thing I mentioned was the undergraduate program. Public health emerged out of medicine in an academic sense in 1915. And when that happened, the entire student body was physicians who were interested in looking at the population health and preventive approach to things and stepping a bit outside of medicine to do that. And so the entire curriculum that we developed in public health historically has been all graduate curriculum. It's only been in the last 10 to 20 years, and most aggressively in the last 10 years, that we've recognized workforce needs that are pushing us to look at backing up and filling in that undergraduate curriculum. And so the university here had been talking about doing that for a long time. It was time to make that happen. And so we actually started our undergraduate program this fall. Have 54 students, I think, that are in the program. Some of them are upperclassmen taking public health classes, and some of them are underclassmen mostly taking gen ed courses. But we were hoping to get 25 to 30 or so when we started with 50. So we're real optimistic that that number is going to grow dramatically in the next few years. So I'll report back on that when we come back. But the other thing that we're doing with that undergraduate curriculum is we're ignoring our intra-public health silos and really creating a curriculum that's based on critical thinking skills and integrated approach to population health kinds of things. And so that's been very exciting as well. And we've actually discovered that so we were looking at this from the front end thinking there's going to be a bunch of faculty who are just not going to be interested in teaching public health. They're spoiled. They've been working with graduate students their whole life. Actually, this whole transformation of our approach to doing that has really energized the faculty that are teaching at the undergraduate level now. And we've got some great students at the undergraduate level, so we're very excited about where that's likely to take us. The third thing I wanted to point out was the notion of policy. So if you're going to be in public health, my perspective is if you're not looking to change policy, you're missing the boat. If you want to try and impact population kinds of outcomes, you need to look to influence policy. And we've had a few people that have been doing some wonderful projects, but we didn't have a big visible presence, and so we're working on that. And Dr. Dunn mentioned the contributions from Kentucky One. We're making a substantial portion with our piece of that pie to build what's going to look like a Kentucky Institute for Health Policy and Analytics, where we're going to build the capacity to look at health policy related questions and institute new training programs that spin off from that. We're already engaged in a very visible Affordable Care Act evaluation here in Jefferson County. We're so fortunate that Kentucky has done so well at the original rollout phase of the ACA implementation. If we can keep the ball rolling and now look at health literacy questions and implementation and access and utilization kinds of questions and do so in a way where we can document that we're making a difference here and on those dimensions as well, we can keep that attention focused in a positive way on Kentucky. You know, one of the other things is our state outcome data on population health are so horrible. All we can do is go up and with really moderate constructive interventions, I think we can make some major strides in the Commonwealth in that end. And we're working collaboratively with colleagues across the table here on this policy issue as well. Dr. Gansel and I in particular are building a relationship with the Foundation for a Healthy Kentucky, and we're looking at some degree transformational kinds of issues that we may pull together in the future as well. And then the West End piece, we've got a couple of interesting projects going there. One of them is going to be a health literacy project as ACA unfolds. Another one is actually going to be a juvenile violence prevention project, which, as any of you that have been here since March 22nd last year know, is a big thing to the mayor and a lot of the community. And so we're excited about getting engaged in that as well. So we're excited about anticipated growth and some of these new initiatives. We're going to be collaborating with all sorts of partners across both the Health Science Center and main campus. We've got a handful of new degree opportunities that'll be coming down the pike, some related to management, some policy. Probably be looking at maternal child health programs, and certainly global will play into that. And there's some incredible research opportunities on the horizon as well, including the partnership with colleagues in medicine looking at the new CTSA opportunity, and pretty optimistic that the team is going to put together a winning proposal this time. So we all look forward to your questions. Thank you.
Greg, thank you very much. The floor is open for questions for any of us. Kent Gardner has a microphone.
A microphone in the other aisle.
Connie, do we have pizza outside? No, that's what it's all about. You don't have to ask questions. You can just eat pizza and ask us outside.
Hi, John. John Roberts, Pediatrics Dean for GME. We've heard Dr. Gansel say 80 faculty members coming in short order. We've heard growth in the other three schools. What about space? Where are we going to put these people? Have you all you got a space plan?
Donna Gisson, who does a marvelous job out of my office working on space planning, is looking at this across the entire Health Science Center with exactly that in mind. Because the first thing I said was, that's great that we finally got the money from Kentucky One now. Where are we going to put everybody? So I can't tell you, John, what the exact recipe for success will be, but we're analyzing that across the board. I'm willing to spend some internal funds to renovate it if necessary, and Donna is very wise about these things and has decided to engage Kentucky One at the same time, because we all know there's space in Fraser and in other areas, and if we have to rent it, we'll rent it. Good question.
So,
yes, Craig.
So one of the things that we're already discussing is some essentially a research service space in West Louisville. And so, there'll be a little bit of rented space that'll be strategic as well as just meeting the need for space.
Go ahead.
Can't help but ask about the NIH depression we're in and how well you think U of L is positioned to survive or thrive in it.
Well, that's a depressing topic. I'm not going to thank you for asking. I think that, I guess I'm of the school that, yes, it's bad. It's probably the worst it's ever been, certainly in our lifetimes. But if we don't, as a university, plow money back into our research infrastructure, then people aren't going to be able to submit grants. They aren't going to want to submit grants. And there's a pretty simple proposition, as you well know, that when you hear people complaining about how they didn't get a grant, some of the time, in fact, when you ask them and probe a little bit, it's, well, did you submit? And the answer is no, you didn't. They felt so glum about it that they didn't submit or didn't resubmit in that cycle. So I personally think that the federal government is, and this isn't Obama, it's just the government in general, does not recognize the value of investing in education and research the way many other formerly third world countries are doing right now. And I personally worry that we're going to lose what has been the next race to the moon because of that. But I think we do have elected officials who recognize that and want to turn that around. And all I can do is hope with the rest of you that that will be the case.
Jerry Reveley from Pediatrics. David, we heard from the four deans about different aspects of global health. And we know certainly in our department we've got our own global health work that's gone on for a couple of decades. Is there an overarching strategy from the Health Sciences Center about how we approach global health? Because it just sounds as though we have different approaches. Even within the School of Medicine, we've got different components of how this has been constructed.
That's a good point, Jerry. I'm going to ask the deans to comment, but I will tell you that what I would like to see happen is that public health under Craig Blakely's leadership creates this Health Policy Institute and leads in this area and coordinates with all the other deans. I mean, Craig, do you want to comment on your views?
Well, I think from a population health perspective, it's real simple. If you're not looking at global, you're not looking at the population. So it's real easy for us to envision global as being central to everything we're doing. I've got considerable assistance in building the vision that I have from both colleagues within the school, but also a colleague on the outside who's been consulting some with us. He spent 6 years running around the region with the Aga Khan Development Network, and he's been an incredible resource. And I know that Shirley Willingans is talking with him about helping discuss or build a university-wide vision for global, because I think that's the kind of thing that, well, and it's already the case that Maureen Taylor Archer has been charged with trying to do some of that, and there's a committee that meets that's providing advice to Shirley and David about that. So there's some of that's in the works, and I know that there are a handful of faculty from different departments that are engaged in the process, but I think that you're right. That's an underlying theme where we need to start rubbing elbows a lot more frequently.
Jerry, I think there are a number of areas where the theme that you just raised could apply. Aging. I mean, I just found out the Kent School of Social Work has incredible bench strength in aging, and that's we often don't know that. Informatics, global health, and so I think we'll gradually begin coordinating these, as we better understand what our desires are to move in these areas and, what strength we have here. So very good point.
And Jerry, as you and I have talked on several occasions, we have typically had a culture that has been a bit siloed. And so I think that has really prevented us from gaining leverage across our strengths. And as you said, even within the School of Medicine, we have probably about 7 different approaches and pockets of global health initiatives. But I think this idea of bringing them together across the Health Science Center could really help us go places.
Yeah, I think that we do need to bring it across the Health Sciences Center, but I'd offer that the comments around the whole university being involved is very important. I think that's the right way to go, because it really is bigger than the Health Sciences Center, because the determinants of health in places like Ghana and West Africa and other places may or may not be due to the medical care. It may be due that there's no money and there's no industry and there's no infrastructure. And so the School of Engineering and Business and Law and others in social work have a role to play with us in trying to help with that. So a university-wide program, as big and grand as that might sound, really is probably where we should be heading toward. But first, we probably need to circle our wagons and get the Health Sciences Center under one forward motion before we approach Russ University.
Well, I would also say that's true not only for global health, but for our community and for our Commonwealth. Because those same sorts of principles, when you look at the determinants, social determinants of health, that medical care accounts for only about 11% of health status, that these other things impact so much more. So we really can't move the needle alone as a School of Medicine, or really even as 4 health science schools. We've got to seek partnerships.
I just want to remind everyone about the 21st Century Initiative that went on for a good 2 years, and I was charged by the provost to chair the committee that had technology, international, and community engagement. And yes, Craig is exactly right. Maureen Taylor Archer is now charged. There is a clear vision for international/global health across the university. And it will look at how each school has their own website. How do we link together? What are the faculty incentives going back to workload? That will be addressed, but it doesn't mean we shouldn't be doing something here. And I would really raise a different question to yours, Jerry. Is it really global health, or is it really interprofessional education, research, service, and practice? That umbrella in itself as a health science center, to me, would just really, help us go forward, because then we could have global, then we could have other research activities. But we aren't really marketing ourselves as a truly interprofessional health science center, and that would really make us unique down the road. That's my opinion.
One other thing I'll just add while you're getting the mic handed out. The folks that we've been working with in Pakistan, that project is slated to be funded by a foundation over there. So obviously we're not looking to spend Commonwealth resources on educating folks in Pakistan. But through those connections, we've met the governor of Punjab province, and he's very interested in building a knowledge park in Lahore. And so there are actually some conversations going on about the possibility of bringing other colleges from across the university to help build instructional programs in that new knowledge park. There was a meeting that was convened in Lahore in May where there were a whole bunch of representatives from British institutions, Australian institutions, and even India in Pakistan, if you believe that. We were the only U.S. institution there, but we're a part of a team of only 2 teams that have signed administrative agreements to look into the possibility of that. So there's another platform that may evolve that will allow, or will push us all to work closely together in a setting like that.
Hi, Eleanor Lederer from Nephrology. So I'm having a little bit of a difficult time reconciling our current culture of dearth and this promise of plenty. So we're being told, at least in the Department of Medicine, that resources are extraordinarily tight, that we can't hire, we have to be working harder, et cetera. And now you're telling me that we're going to be able to hire 80 faculty, which is absolutely wonderful news. How are we going to decide how those faculty are allocated? What are going to be the priorities? I mean, whose priorities are these going to be? Are they going to be the universities, ULPs, Kentucky Ones? How is that going to be decided?
We have gone through, Ellen, thank you for the question. We've gone through a very arduous and detailed investment proposal process. And so the first step in this process was that Ruth Brinkley, as the CEO of Kentucky One, and I had to agree on the areas in which those investments would occur. So it was a joint process. We then, there were groups, and Jesse was involved in one of the ones, which was specialty care, and looked very, very carefully at what they believed to be current needs. So these are 18 groups of 2 to 3 people, all of whom were leaders in health sciences, and presented those to Kentucky One. And Kentucky One then went through a process of saying, does this match our vision as well, our joint vision to grow in these areas? Dean Dorton Allen Ford was engaged to create a return on investment, because this is one-time money. And so the dearth that we're experiencing is due to recurring state funds being repeatedly cut. And this one-time money has to be very carefully allocated, because at the end of 3 years, if we hire an internist, a cardiac surgeon, you name it, they have to be self-sufficient at the end of that time, or we have to create a dynamic with Kentucky One that they see the value of supporting those individuals. So this has been going on for about a year now, and the proposals all have been approved. There's some that are not personnel driven. Marcia Hearn has one where we were able to convince the Kentucky One folks of the wisdom of actually renovating and building out areas of the School of Nursing to train more nurses for their workforce. Craig Blakely has one that is really informatics and populational health driven, which is something that Kentucky One and CHI want to do. They want to be able to measure populational health, but they really don't have tools to do it. So we're offering to provide them those tools. So these plans have been vetted and re-vetted, and again, it's an opportunity for growth, but if we don't do it wisely and create sustainable models, we'll be back in the dearth phase at year 4, and that's not going to happen.
Bob Statt, the School of Dentistry. I don't really have a question, but rather a comment, and you've touched on it 3 or 4 times, and that's the state budget. The 14 cuts that we've had in the last 13 years, it's really a request for the people here in the audience, because many of you are well placed, and we need help in the legislature to get people to start appreciating the value of higher education, and that Kentucky right now is one of 9 states that hasn't reinvested in higher education since the recession. 41 other states have. And we have to get some activity going in the legislature and to get that turned around, at least so we can maintain funding rather than losing funding.
Thank you, Bob. All right, well, it's 6 o'clock. There's food and refreshments outside. Please stay if you have additional questions. We're happy to answer them. I'd like to thank the deans for participating. Thank you all very much.